Hey guys, it's Sarah here. So in this video, I'm going to be taking you through my storage room, and I'm going to show you what we use and what most hospitals have. Okay, so it's like a tour through storage room. So here we go. Okay, so here are just regular pictures for water. Here are gloves, all different sizes of gloves. Here are tissues. Here are wipes. Here are sacks. So these sacks are meant to prevent people from falling. They're non-slip sacks. Here are different sizes. Here's belongings bags, like to put the patient's clothing, etc. Here are toothbrushes. Here is a strainer. Someone has a kidney stone, then you send them home with this, and then they urinate in it and it strains to see if a kidney, like a stone, passed. Here's just lotions. Here are sterile specimens, so it could be sputum, whatever, like that. Here's lubricating jelly to make stuff more comfortable. You could use it for NG tube, you could use it for all different stuff, a rectal temperature, etc. Here's the strips for the glucometer, and here are what you would prick the person with. So you'd prick them in the finger like that, and you would put the blood on the strip. Here are urine cups. So you ask the patient to pee in here, you put a label on top, and then you open this, and you would take the urine. So here would be so here would be your container. You would put it through here, you would open, and it would just literally come right out over here. So this opens over here. There's like a needle inside. Put it in. The urine comes in here, and here is your sample. So here's a bedpan for patients who don't want getting up to go to the bathroom. Here's a urine leg bag. So when you send the patient home with a Foley catheter, which is over here, here's a Foley catheter. It's a sterile procedure, so you don't want to open that now, but then, so it comes with like a box. So when they're going home, they can't like have a huge box. So you would have like a leg bag over here. It goes on the foot. So here are just different tubes for blood, different stuff. Like one could be troponin, CBC. I mean, every hospital has their own color system. Here's PTT. Every hospital has their own color system. So those are the blood. Here's the urine. Here's a drug urine, urinalysis, etc. And these are just a waste tube, usually. These are the urine cultures. So here's all the stuff for IV. So you have your tourniquet over here. You have your catheters. You have all different gauges. You have an 18 gauge. You have a 20 gauge. So most patients, adult patients, are going to be 18 and 20 gauge. You have a 16 gauge, which you rarely use. It's obviously a bigger, better IV, but it's pretty painful. Then you have your 22 gauge, which are used on like small or tiny veins, like pediatrics, etc. So these are for the IVs. If you were just drawing blood and you don't want to keep the IV in, you would do this. A regular butterfly needle. And it would attach, you see that point over there? That would attach to one of these. Then you put your blood tubes in there to collect blood. And these also come in different gauges. 23 and over here. Here is an IV start kit. So what it has in here, it has a tegaderm to keep the IV in place. You have your, right over there, it's alcohol swab. You have your tape, and you have the tourniquet. Here, normally you would take a catheter, and once you get it into the vein, you attach this to it. And then that would be your IV. But if you wanted to draw blood and take blood off the IV, you would take this and you would attach it. And you attach this to the IV instead. And then you would pull back. So you just pull back and, like flush, pull back, and take out blood. Here are specimen bags, just to send the blood up. Here are EKG papers, which like the little EKG stuff print on. Here is an ABG. So these are if you're doing an arterial blood stick, they're called ABGs. Here are all different swabs, like for the flu and different stuff, MRSA, different stuff like that. Here are your blood cultures. So with the blood cultures, you always want to use alcohol swab first. You have to get, see here's a set of blood cultures, so you need two. So you need one set and you need another one in two different places. They can't be from the same place. So you're gonna have to stick the person twice. Here's just alcohol swabs. Here are different syringes, different sizes, and alcohol wipes. Here's just a regular dressing to secure your IV. Next we move on to over here. So here are all different type of sutures, which you'll be getting for the doctor. You won't be using yourself. Here are different dressings, the same thing, pretty much. Here's all different type of tapes. And we have our irrigation tube, which you like flush a G tube with or something like that. Here are cardiac leads. You would put on the leads and it would hook up the cardiac monitor so you can monitor your patient. Here's all different gauze sizes. Here we have crutches. They're all different sizes. So the way this works is over here you would push this in and you go to however tall the patient is. You have a 6'1", you go right here, and that would be the correct size. Okay, here you have all different blood pressure cups, different sizes. It's important to make sure it's the right size so you don't get a falsely elevated or low blood pressure. Here are cardiac leads. Here's all different type of oxygen delivery devices. So here's the nasal cannula. Over here, it goes in the nose. Over here is the two stuff you put in your nose. Here you would put medication. Let's say you have albuterol, it'll go in here. Here's an ambu bag. Until someone is intubated, you would use this. And this part would go on the patient's mouth, and you would be doing this, pushing it in once every 6 seconds. Here's a peak flow meter. You ask them to breathe in and see the best they could get to. Here's the top to the canister. It's for suction. You have a big tube and it'll go to the wall suction. And here's called a yank hour to suction a patient. Here's a pulse ox, so you can monitor them. This goes around their finger. And it's just hydrogen peroxide. And then we go on to this part. There's all different ACE bandages, all different types for different stuff. And here's to clean and change your patient. Here is the neck brace. So if someone comes in spinal precaution, pretty much, you don't want them to move their neck until they're cleared. So here's a machine that you put in. So here's a UPT test. It tests if someone's pregnant. You put it in. You put a few drops in there. You run it, and it will tell you. It also turns over. And you could put in a urine dipstick. Okay, so here we got all different type of fluids. You have your normal saline, 1,000. It comes in 250, 500, 50. You see, it comes in 500. It comes. You also have it with some dextrose. If the sugar is a little low, if they're NPO, they're not eating. Some potassium. You have them in all different sizes, and 500, etc. every different type of fluid, lactator ringer. And the way you would put it in is you would put this. So here's your tubing. This would go right in. You take off the blue thing, and this connects to that. And then this goes to the patient's IV. And if you want, you could put on valve flow, so it would make the rate. So if you wanted to go to 175, etc. So you would attach this to that part. This to here. And then that part would go to the IV. So here's for the wide tubing. As you see over here, like, so this is wide tubing. One's for the blood, one's for the saline for flush. So here are your flushes. You're going to flush everything, just normal saline to flush. Here are essential dressing changes. Obviously sterile technique. Here's a condom catheter. So you put this on the patient, on a male patient obviously, over the penis, and then they urinate through that and you get urine specimen. Here's STD prophylaxis. So this goes around the patient's foot, and this attaches to the machine, and because the patients are not ambulating, so it makes sure that it compresses and goes like that, so that the blood flow continues to go. Here, if someone has a pressure ulcer, so this would go on top. It's called a Metholex. Here's an incentive spirometer. You can see how good they do. Here is sterile water for oxygen, so that the mouth doesn't get so dry. Here is a straight catheter. So this goes, top comes up, this goes in the patient, and then you collect the sample. Okay, so here's an NG tube. So this part, the white part, you take off and you put in suction. So the tubing for suction. And let's see if you can see the other part. Well, the other part goes into the patient's nose over here. Lubricant, let's say gel in it, and you put it right up the patient's nostrils. And last but not least for this video is forceps to do pap smears and vaginal exams. So thank you for watching. Hope you liked it. Let me know if you did. And stay tuned. See you.